Would you rather have a Medicare supplement policy or a Medicare Advantage plan? Let's compare them. First, if you go into a Medicare supplement policy, your insurer is the Centers for Medicare and Medicaid Services. In other words, you are staying in the federal government program. If you go to a Medicare Advantage plan, you are going to have private managed care. Next, whether you're in Original Medicare with the supplement or Medicare Part C, a Medicare Advantage plan, you must enroll in Medicare Part A and Medicare Part B. A lot of people think that if they go to C, they can avoid the Part B monthly premium, but under both setups, you gotta pay for Part B. When it comes to doctors, under Original Medicare, you can see any doctor in the United States that accepts Medicare. When it comes to Medicare Advantage, you are going to typically have a network. It could be an HMO or a PPO. It could be local, regional, or national. So it's very important that if you're going to go this route, you make sure your doctors are in those networks. Next, and a big one you're probably all waiting on, with a Medicare supplement policy, you are going to have a monthly premium. Depending on which plan you choose, that's going to help determine what the cost is going to be. But for the most part, if you go with Medicare Supplement Plan G or N, you're going to cover most of those out-of-pocket costs. So what you're doing with G or N is you're paying a monthly premium to fill in the dollar gaps of a Medicare-approved claim. Medicare is not designed to cover every dollar, so Medicare will pay its portion, and then your supplement's going to pay the other part. When it comes to Medicare Advantage, the system is totally different. You typically have a $0 monthly premium, and in exchange for that, you're going to cost share as you go. Most plans have something called a MOOP. That is a max out of pocket that you could spend. Each plan defines what that MOOP is going to be. A MOOP is not a deductible. It's not something you owe up front, but what it would mean is every time you have a service, there's a possibility of a copay or a coinsurance. So if your MOOP is $6,000 and you have a 3-night hospital stay and the copay is $300 a night, that is $900. So now for the rest of the year, your MOOP has been lowered to $5,100. When it comes to prescription drug plan coverage, with this direction, you have to get a separate standalone plan. You're often going to have a premium and copays. You could pay up to $2,000 in copays for drugs that are in your plan's formulary. This route, typically you're going to look for a Medicare Advantage plan with Part D built in. There are definitely some Medicare Advantage plans without them. Sometimes veterans choose that, etc. But the point being is in this setup, just like this setup, you're going to have to pay copays for your medications, typically up to $2,000, just depending on what your costs are. But that doesn't mean you'll spend $2,000. But in both scenarios, that is the max for a covered drug. Under this system with a Medicare supplement policy, you do not need prior authorization for your major services. One exception could be durable medical equipment, but for the most part, your doctor is determining your medically necessary care. In this system, for some of the bigger services, you will need prior authorization. So for example, if you needed skilled nursing facility care, under this system, after your doctor says, you need to go to skilled nursing care, you go. Under this system, before you go, the managed care company must agree with your doctor. Under this system, in Medicare supplement policies, you do not have dental, vision, and hearing. If you want that kind of coverage, you typically have to get your own standalone policy. There could be some Medicare supplement companies that offer a gym, certain things, or you could pay a little more for dental, but it's not built into Original Medicare. Over here, all those different kind of perks may be a part of your plan. So when you're choosing a plan after you figured out that your doctors are in the plan, that your drugs are cost efficient in the plan, then you could compare what are the different perks, whether it is the 3 I already mentioned, a gym, over-the-counter benefits, etc. But certainly do not choose your healthcare just based on perks. Choose your healthcare based on what best fits your needs. And then last but not least, under both systems, if you have IRMA, income-related monthly adjustments amount, it's going to be applied. So over here, you would pay it on B and D. And over here, you may think, again, do I have to pay B if I'm in C? And the answer is yes. And even if your drug plan is built into the Medicare Advantage plan, the IRMA charges will apply for Part D if you are a higher income earner. One more thing I want to add under this system, where I mentioned you could see any doctor in the United States as long as they accept Medicare. It's the same quote unquote network for your Medicare supplement policy. Which is better? Everybody always wants me to tell them which is better. And what I try to do is figure out what is best for you. If we were not thinking about dollars at all, this would be an easy decision because you're not dealing with the concept of prior authorization. But that doesn't mean that this is right for everybody. And so what I try to do with my clients is really listen, talk to them, and figure out which path is going to serve them the best in retirement.